Hi, welcome to the brand new episode of You Diary. Motherhood is a great honor and pride. Children we bring into this world are actually miniatures of ourselves. Every woman dreams of becoming a mother and many accomplish this naturally while some need assistance. Consulting a doctor at the right time for this is very important. To discuss further on this, we have with us Dr. Swathy Singh, Infertility Specialist, Craft Hospital, Kodungallur. Hello doctor, welcome to the show.
Thanks for inviting me.
Doctor, first and foremost, I would like to ask you, how common is this infertility?
Actually, it's fairly common these days. Nowadays, 1 in 8 couple, they suffer from infertility.
Okay.
And like we say, many patients, even young couples, even ladies who are like in their 30, 35, we see them coming with infertility problem.
What could be the common causes for this?
See, one of the main causes for infertility is delaying childbirth. As we all know, the best chance for a lady to conceive in her 20s. But because of education, career commitments, most of the ladies are delaying pregnancy nowadays. Then lifestyle factors, like we are having more sedentary lifestyle, less exercises, then having less fresh fruits and vegetables, taking food which is directly taken out from a box which contains preservative and many times harmful chemicals which we don't even know what they have put in. So because of all these factors, air pollution, loss of pesticide in our food chain, all this contribute to bad health and finally leads to infertility.
So you mean to say that this pollutions and environmental toxins have taken a toll on our health?
That is the fact.
Okay. We have a lot of queries from our audience. This is the first query.
Hello doctor, my name is Nilina Philip. I'm working in USD Global. My question for you is, my sister had miscarriage 6 months back. It was her first pregnancy and we are concerned about her health issues. So is there any test that she need to undergo?
Okay, so your sister had a miscarriage 6 months back only. At this point, I would suggest them to go for a detailed testing because this was the first miscarriage. Only thing I would suggest to go for a scan, ultrasound scan to check for any fibroid, adenomyosis or polyp problem in the uterus. And then if that is normal, to go for a sugar testing, thyroid, prolactin. These are not advanced testing. This we do for all ladies who are pregnant. And if these things are normal, they can just try for a natural pregnancy after 3 months and she should be on folic acid supplements.
Okay, in that case, when do you suggest this advanced testing?
See, advanced testing, we like some tests which are more expensive and which are meant to look for some specific problem. Like doing a hysteroscopy in a lady with repeated miscarriage. The aim of the hysteroscopy is to look for any polyp inside the uterus or some adhesion bands. Then going for some blood testing to look for presence of antibodies.
Okay doctor, we'll go to the next query.
Hello doctor, my sister got married 2 years back. She has done a treatment called IUI for 2 times. She couldn't conceive. What are the other options for her?
IUI is basically intrauterine insemination. It's a process where we collect semen sample, we prepare it inside the lab, we separate actively moving sperm from it, and that sperm we put directly inside the uterus with help of a plastic cannula. This usually is done for the couples who have low count of sperm, less movement of sperm, or couples who are not able to have regular intercourse. For them we offer IUI. Couples with unexplained infertility, we do IUI. As in this question, she has already done 2 IUI and she is a young patient. I would suggest her to go for 2 more IUI. If after 2 IUI they don't conceive, then they should go for further evaluation and maybe higher advanced treatments.
Doctor, for this IUI, what is the success rate of this IUI treatment?
It varies a lot actually. It can be as low as 7 to 8% to as good as 20-25%. That totally depends. If the lady is young, duration of infertility is short, we expect higher pregnancy rate. Similarly, when we use tablets for ovulation, pregnancy rate will be little lower. When we use hormone injection, those are costly, but then pregnancy rates are also better because more eggs are growing in the ovary.
Doctor, what are the do's and don'ts that a patient should follow post IUI?
There are no do's and don'ts. They should live a normal life and relax.
Okay, so there is no doubt of any bed rest.
No.
Okay. My elder cousin is 26 year old. She got married last year. She doesn't get her periods every month. She had not conceived yet. Her gynecologist told her that it is because of PCOD. Is there any good permanent treatment for this?
See, PCOD is polycystic ovarian disorder. This is a problem with many phases. The basic problem here is it's not that ovaries are having many cysts, they are having many small follicles, what I was talking about. So they are more than normal. Normal lady will be having 3, 10, 11 follicles, but the PCOD ladies will be having sometimes 18, 20, 30 follicles per ovary. This is abnormal. This is mainly because of hormone imbalance inside the body. There is excess of male hormones over female hormones. So because of this hormone imbalance, they don't ovulate every month. There is excess of hormone which leads to oily skin, pimples over body, facial hair all over the body, then irregular cycles. Polycystic ladies, when they conceive, they are at higher risk for having a miscarriage.